There are certainly some indirect business benefits to just improving overall quality. Training programs are certainly motivated to have higher quality training tools for their trainees. One of the big business motivators has actually been around clinical research on the provider front too. As I'm sure you're familiar, whether it's in private practice or in academic groups, there is a lot of motivation to have high functioning research organizations within those groups. And for GI practices that can run efficient clinical research groups with low limited overhead, can actually become a profit center for what they do, because the pharma companies, again, are highly motivated to find sites that are good at producing high quality patients for their trials. And so what we can do for the clinical trial sites, the healthcare providers, is help them find more patients within their pre-existing populations that are good candidates for research. And we can do that without them having to add additional overhead. I don't know how familiar you are with clinical trials right now, but it tends to be a very manual, intensive process where you have to hire skilled clinical research coordinators. And certain clinical research coordinators have more experience than others. They're better at finding and selecting patients and administering these trials. And it can be a lot of overhead. And I know there have been some groups, especially in private practice, that have tried to spin up clinical research arms and have struggled to do so. They end up, spending a lot on overhead and not actually producing much in terms of patient enrollment. And when they do that, they're not being compensated by the pharma companies enough to support the overhead. So we can basically be a free tool that helps them drive a more profitable research center within their practice. I'm certainly biased in the space, but I still feel like there's a huge opportunity to add a digital layer to what's going on in GI and endoscopy at large. I think there's just so many opportunities for software solutions to come in and help out. And I think we're still in the very early stages of doing so. We're pretty friendly with a number of digital health companies like Sonar MD and Oshi Health. And I think what they're doing is incredibly compelling and starting to bring the patient experience much more into the fold when it comes to software. So I think we're going to see at some point in the next 5 years, a digital layer emerge on top of what's happening in endoscopy that's goes well beyond just endoscopy report writing. When I look at the EHR is kind of the de facto digital layer of healthcare right now. And I've always felt like EHR is, the term is kind of a misnomer. To call it an electronic health record is not doing justice to the term health in the equation there. They're really electronic health billing records. If you look at EHR, is designed as a billing tool to facilitate optimal billing in healthcare. And I think there's still an opportunity to build software that creates a proper health record, a clinical record that's viable for clinicians to use in day-to-day clinical practice. So I don't know. I don't know if that exactly answers the question, but I think we're going to get to a point where it's not just hardware being used for endoscopy, that there's true digital tools on top of the endoscopy stack.